Good morning, Mr. Derrick. I'm gonna wash my hands. My name is Kaitlin. I'm a nursing student. Today I'll be doing a physical assessment. I've already obtained all of your vital signs, so I'm going to check your wristband. Can you state your full name, date of birth?
Wade Derrick, July 11th, 1979.
All right, thank you, Mr. Derrick. I'm gonna go ahead and close the door to provide patient privacy. Okay, how is your sleep been?
It's good.
Okay, how's your appetite?
Good.
Okay, well, what brings you into the hospital today?
I'm here for a wellness checkup.
Okay, great. Can you tell me what day it is?
It is Sunday.
And what time it is?
8:30 a.m.
Okay, my patient is awake, alert, and oriented times 4. All right, Mr. Derrick, are you experiencing any pain today?
No.
Okay, patient denies pain. However, if he had stated he had any pain, I would assess using old cards. Onset, location, duration, characteristics, aggravating factors, radiating, treatment, and severity. Okay, I'm going to assess cranial nerves 2, 3, 4, and 6. Okay, I'm going to use this folder to provide some shade so I can check your pupils. Okay, so I'm going to have you just look straight ahead. Okay, great. All right, now I just need you to look behind me and look back at me. Okay, wonderful. Now I just need you to follow my pen with your eyes only.
Okay.
Okay, great job. Can you tell me how many fingers I'm holding up?
4.
Okay, great, thank you. All right, now I'm going to assess cranial nerves 5, 7 through 12. So I will start by inspecting my patient's lip condition and mucous membrane. So, okay, great. Pink and moist. Do not note any lesions and full dentation. Okay, now I'm gonna have you clench your teeth, smile, puff out your cheeks. Okay, raise your eyebrows. Wonderful. Okay, stick out your tongue, move it side to side. Okay, no lateral deviation. Okay, now I'm gonna get you to say ah, nice and big. All right, thank you. All right, Mr. Derrick, when you're brushing your teeth, do you sometimes gag?
Yes.
Okay, so soft palate rises symmetrically and gag reflex is intact. Okay, I'm going to check your hearing. So I'm gonna stand slightly behind you, whisper, you just repeat what you hear.
Okay.
Go.
Go. Saints.
Okay. All right, great job. Okay, now I'm going to place my hand against your cheek. I just need you to push against my hand.
Okay.
Okay. Okay, now I'm going to place my hand on your shoulders. Just do a nice little shrug. Okay, great. Thank you so much. All right, and lastly, do you have any difficulty swallowing?
No.
Okay, great. Now we're going to move on to your lungs. Okay, so I'm going to have you sit up nice and straight for me. Okay, I'm going to listen for 1 full inspiration and 1 full expiration. Okay, now I'm going to auscultate your posterior side. So I'm going to have you put your chin to your chest. Give yourself a nice big hug.
Okay.
Okay, now I will auscultate the lateral sides. So I will listen to the 2 lobes on the left and the 3 lobes on the right. Okay, all right, Mr. Derrick, you can relax now. Okay, so patient's chest rises and falls symmetrically. Respirations are even and unlabored. Okay, now we're going to listen to your heart. I will listen to the patient's aortic, right second intercostal space, sternal border, pulmonatics, second intercostal space, sternal border. Erb's point, third intercostal space, sternal border. Tricuspid, fourth intercostal space, lower sternal border. And mitral valve, fifth intercostal space, mid-clavicular line. Okay, S1 and S2 heard distinctly, and rhythm is regular. Okay, now we are going to move on to your abdomen. Before I start this part of the assessment, do you need to use the restroom?
No.
Okay. Do you have any complications with urination or bowel movements?
I don't.
Okay, when was your last bowel movement?
About 2 hours ago.
Okay, great. I'm going to have you lay back on the bed.
Okay.
Okay, I will inspect my patient's abdomen. Abdomen is concave. Okay, Mr. Derrick, I'm going to have you do a nice little crunch. Okay, do not suspect any hernia. Okay, now we're going to go ahead and listen to your bowel sounds. So I will start in the right lower quadrant, move to the right upper quadrant, left upper quadrant, and then finally the left lower quadrant. Okay, active bowel sounds in all 4 quadrants. Okay, now we're going to palpate the abdomen. Before I begin, do you have any pain or tenderness?
No.
Okay. Patient denies any pain or tenderness. However, if he did, I would palpate that section last. All right, Mr. Derrick, just let me know if you experience any pain or tenderness as I'm doing this.
Okay.
Okay. No tenderness. I'll have you sit back up. Okay. Now I'm going to move on to your skin. So I'm going to check your upper and lower extremities for temperature. Okay. Patient is warm and dry. Now I'm going to inspect your bilateral upper and lower extremities for edema. Okay, no edema present. Now I'm going to check your skin turgor. So I'm gonna have your hand. I'm gonna do a nice little pinch here. Okay, your other hand. Okay, instant recoil, so that's great. Now I'm going to check your capillary refill. So I need your hand. Okay, and your other hand. And now I'll check your toes. Okay, capillary refill are brisk. Okay, now I'm going to check your radial pulse and your dorsalis pedis pulse. Okay. All right, heart rate is regular rate in rhythm, 2+ strength and bilaterally equal. Okay, now I am going to have you lay in the prone position on your abdomen. Now I will inspect my patient's head, scapula, coccyx, and heels. Okay, no skin breakdown noted. Okay, Mr. Derrick, you can sit back up for me. Okay, now I'm going to check your grip strength, so I'll just have you squeeze my hands. Okay, great, and I'll have you lay back just one more time. Okay, in the supine position on your back. Okay, now I'm going to check your dorsal flexion, so I'm going to have you point your toes to your nose. Okay, great, and now I'm going to have you pump the brakes. Okay, great. Thank you, Mr. Derrick. Your grip strength, dorsal flexion and plantar flexion have all been assessed and are equally symmetrical. Okay. All right, now we are finished with our assessment. Have your bed in lowest position, your side rails up ×2, and your call bell is within reach. Before I leave, do you need anything from me? Do you need to use the restroom?
No.
Okay, are you experiencing any pain?
No.
Okay, is your position comfortable?
Yeah.
Okay, do you need me to grab anything for you?
I'm good, thank you.
Okay, great. My patient does not have any interventions, IVs, IVs, dressings, tubes. If he did, I would assess them. All right, thank you, Mr. Derrick. Hope you have a wonderful rest of your day.
You too, thank you.